More. I'm joined by Dr. Leo Nissola. Dr. Nissola is an immunotherapy scientist as well as an advisor for COVID Act Now, a nonprofit working to provide up-to-date COVID-19 data. Dr. Nissola, welcome. Let's start with news out of the UK. Researchers there say the Oxford-AstraZeneca vaccine can also help reduce the spread of the virus. How significant is that?
Thanks for having me. Happy to be back and happy to share some positive news too for a change. I think AstraZeneca has faced some challenges in their clinical trials, and the data that we are seeing right now that is supporting some early evidence that perhaps their vaccine may prevent the spread of the virus. It's pretty reassuring, but again, those are not yet facts. We still need to have a peer review process of the paper that was preprint, made online, and made available today. And we also need to understand if that data correlates to all the other subjects and not specifically to that study. So it is still early for us to make sure, it's too early for us to know for a fact that it prevents the spread of the virus, but it's pretty reassuring.
Yeah, but as you point out, the fact that it's still subject to peer review, it's a really important point for people to keep in mind. So coronavirus
That's right.
variants, we know, are a major concern right now, and scientists fear if the virus continues to evolve, existing vaccines could become less effective. Doctor, how quickly and easily can this virus actually mutate, and could we be dealing with even more variants in the near future?
That's a very important point because we are going to deal with new variants, very likely, because we still have community spread. You see, I think Dr. Fauci made this statement a week ago or so, and I think it's a very clear message that the virus only mutates when it replicates inside a human. So, by allowing community spread, by allowing folks to still have a new infection while we are giving this virus immunotherapy drug combinations, while we're giving this virus convalescent plasma, while we're giving it to some people vaccines, we are pressure testing this virus in a condition in which the community spread still occurs. So I am concerned, especially that public health officials in England found a twice mutated variant that may escape some antibody treatment response. So it is scary. It's scary a little bit.
Yeah, well, how difficult would it be, doctor, to actually alter a vaccine if it's proven that they are less effective against new variants?
I think the mRNA vaccines have a platform that allows for the technology to be updated, that allows the vaccines to receive a different code and then address the specific needs for specific variants. So I'm not worried about the vaccines, and I think drug makers are already foreseeing this, and perhaps some of us will need a booster shot in the future.
Well, Doctor, President Biden says that he wants to reopen the majority of American schools by the end of his first 100 days in office, which means the end of April. From a medical perspective, what do you think needs to be done to meet that goal?
I think we have a tremendous challenge in our hands now that we need to reopen schools, but I agree that we need to reopen schools safely. And when I think about safety, I think about folks that are falling ill to this disease and requiring hospitalizations and requiring ventilators and eventually dying. And I would be very concerned if we reopen the schools without immunizing our teachers. I do think that we should do this in a safe manner. And for me, that would be first making sure that our teachers are vaccinated before we think about reopening schools, and also that we have testing protocols in place. And we have technology to do that right now, especially with the rapid tests.
All right, Dr. Leo Nissola. Doctor, always great to have your expertise. Thank you.
Thanks for having me.